In our previous video on blood physiology, we talked about the physiological variation of the red blood cell count. In this video, we're going to be focusing on the pathological variation of the red blood cell count. Abnormal increase in red blood cell count is known as pathological polycythemia. In pathological polycythemia, the red blood cell count increases above 7 million per cubic millimeter of blood. Pathological polycythemia is of two types. We have the primary polycythemia and secondary polycythemia. Primary polycythemia is known as polycythemia vera. It is a disease characterized by persistent increase in red blood cell count, above 4 million per cubic millimeter of blood. It also brings about increase in white blood cell count, above 24,000 cubic millimeter of blood. Normally, white blood cell in adults ranges between 4,000 and 11,000 per cubic millimeter of blood. Polycythemia vera occurs in myeloproliferative disorders. Myeloproliferative disorders are blood cancers caused by changes in stem cells inside bone marrow. A good example of myeloproliferative disorder is malignancy of red bone marrow. In secondary polycythemia, there are some pathological conditions that cause hypoxia, that is, decrease in oxygen level in body tissues. Hypoxia then stimulates kidney to release erythropoietin. Erythropoietin is an important hormone for erythropoiesis. It stimulates the bone marrow, resulting in increased red blood cell count. Let's have a look at some of these conditions that causes hypoxia and also bring about increase in red blood cell count. These conditions are congenital heart disease, chronic carbon monoxide poisoning, respiratory disorders like emphysema. Emphysema is a lung condition that causes shortness of breath. Conditions like repeated hemorrhage also causes polycythemia. Disease like Egzod's disease also causes polycythemia. Egzod's disease is associated with hypertrophy of the right ventricle and obstruction of blood flow to the lungs. All these conditions causes hypoxia and therefore indirectly lead to polycythemia through action of erythropoietin on bone marrow. Pathological condition that leads to decrease in red blood cell count is anemia. It is a blood disorder that is characterized by reduction of red blood cell count, hemoglobin content, and packed cell volume. We will treat anemia on a different video entirely. Please endeavor to watch this video at least 2 times. Take some notes, ask some questions, pause and think. All these will help you to remember and understand. Don't forget to like and subscribe. Please use the comment section. God bless you immensely.